Addiction can mean many things. Some people are addicted to gambling, others to alcohol, drugs, or even work.
Unfortunately, addiction impacts not only the addict, but the family as well as friends. How does a person recover and find meaning in life?
Join us next on Lawyers, Guns, and Money for those answers.
Now, Lawyers, Guns, and Money with criminal defense attorneys David Houston and Scott Freeman.
Good day and welcome to Lawyers, Guns, and Money. I'm David Houston.
I'm Scott Freeman. Stress can wreak havoc on our lives. Reliance on drugs or alcohol, unfortunately, can make things worse.
How does somebody make a positive change and recover from addiction to learn and manage stress? We'd like to welcome psychotherapist Tom Lavin to Lawyers, Guns, and Money. Tom, you've been kind enough to join us on many occasions to discuss very topical issues, and today, of course, we're going to speak to addiction and what people can do about that, and thank you for joining us.
Yeah, David, Scott, thank you very much for having me. And, you know, the main thing that I wanted to share with your viewers today is that even though every day there are thousands of people who cross that line into addiction, there are also thousands of people every day who can walk through that door of recovery. And so any of your viewers who are having problems with an addiction or they're concerned about a family member that has an addictive disorder, that is the good news, is that there is recovery. People can and do get better.
You know, Tom, some of the challenges that Dave and I see in our practice as criminal defense attorneys is that sometimes we'll have cases like a driving under the influence offense. We'll have a drug possession offense. And although they are technically crimes, they're really crimes of addiction in a variety of ways. So you'll have someone who has, let's say, a family member who won't recognize the fact that they're an alcoholic.
Yes.
And, you know, they just touch base with David or I in a DUI setting. But in reality, it's much deeper than that. Whatever we do from a criminal defense standpoint is one thing, but then the individual goes back to their family and they're an alcoholic. How do they reach out to that person to get them to understand that, you know, the reason they're talking to Dave or I is because they got a DUI?
Yeah. You know, recovery really starts with honesty. And that's the person, again, the alcoholic, the drug addict, the gambler, the sex addict, looking in the mirror and taking a good, honest look at themselves and saying, you know what, I have a problem. My life is totally messed up. Now, what we see is that someone that does have an addictive disorder, rather than being honest, they will tend to deny or minimize what's going on.
How do you get the message?
They will say, I'm not that bad. I'm not as bad as so-and-so. I'll quit tomorrow. I'll quit next week. And so hitting bottom is really important. Hitting bottom is about feeling the pain of the decisions that we've made. One of the things that happens is so often the family will like run around with a mattress, and every time the alcoholic or drug addict or gambler starts to fall and hit their head on the pavement, they're there with the mattress to cushion the blow.
Exactly.
And so on one hand, of course, we want to encourage families to be compassionate and empathic, but on the other hand, we want to encourage them to not enable, to allow someone to go ahead and hit their head on the concrete and feel the consequences of this behavior. And as a result of that, that's where honesty can begin. To say, you know what, I really do have a problem, and I don't want to lose my wife or my kids or my job, or I don't want to go to jail, I don't want to go to prison, I don't want my children to run away from me. All of those terrible things that happen with alcoholics and drug addicts and gamblers.
Now, we deal with people all the time, especially in family settings. I know Scott, and I can speak for him on this as well. We'll get calls from folks that are the boyfriends, girlfriends, mothers, fathers, loved ones, where they'll get a hold of us and say, well, you know, my significant other or my son has this terrible problem, and then, of course, you talk to that person, and that person acts like the other person bumped their head. How do you get that person? Maybe there isn't a way, but is there a way to get that person to the point that they understand there is a problem before they have that traumatic episode that is called rock bottom?
You know, the thing that needs to happen really is what's something called natural consequences. Usually people who will go to the alcoholic, the drug addict, the gambler and say, do you know this? Do you know you have this problem? Do you know what you did last night? Do you know what you did last week? Have you looked at the checkbook? I'm not going to, you know, the employer is calling again and asking where you're at. That person is just looked at as a nag.
Exactly.
And so usually what needs to happen is, again, this idea of hitting their head on the asphalt, natural consequences, that in fact life needs to speak with them. And so taking away the protections and letting them experience the natural consequences of going to jail, going to prison, not calling up the employer and making excuses for them, letting the employer confront them that you have a problem. Do you know how many days you've missed? Do you know how many patient complaints we've received or customer complaints we've received? So natural consequences is really what gets the attention of the person who's an addict.
Which begs the main question. You've got the family member, and you use the analogy of the mattress to cushion the blow. The family member's so used to putting that mattress out. Isn't the real issue is to counsel the family member to move the mattress away? So how does a family member who, to use your terminology, who's enabling the alcoholic or addict, how do they have the courage to see pain in the person who's the addict not to put that mattress down there? How do they deal? How are they able to stand back and they know the person's going to go face first in the concrete and not put that? They're so used to putting the mattress out, and they know, and you're expressing how dangerous that is because it keeps the addiction going. How do they deal with not that mattress?
Well, one of the things that family members usually will say is, I can't stop bailing him or her out because I love my son or my daughter, my spouse. And so one of the things that we will do is we will talk with them about real love. How much do you really love this person? Do you love them enough to let go?
Exactly.
There's this key thing about that's called detaching with love, where we detach with the person. Even though we love them, we detach from them. Can we let them go? Do we see that actually the way that we are loving them is in fact killing them because we're allowing that addiction to continue on? Can you? And so when I talk with parents or spouses or adult children, if they're concerned, do you love your mom or your dad or your son or your daughter enough to let them go and experience the consequence of it? Can you stand back and deal with your own anxiety, which is a big element in this? The anxiety that a loved one is really hurting themselves and may end up in jail or prison or dead or with a chronic illness. Or can you let them go? Can you trust the process and realize that maybe if they hit their head on the concrete one or two more times, they might say, oh my gosh, I've got a problem. Can you trust that process? So detaching with love is a form of letting go. And again, with family members, do you love your loved one enough to detach with love and let go?
You know, and we see this on television. I know they had a program called Intervention where family members would get together, and it seems the key part of that is when you say something, you have to mean it. Because I guess it would be almost then enabling to have one of those big sessions and we're going to cut you loose if you don't get your life together, and then of course you're right back there the next day helping. Then you seem to have lost credibility. If that's happened, if you've lost that credibility as a family member or a loved one, is there anything you can do to reassert yourself and to gain that credibility back?
Yeah, it's real simple, Dave, and that is that action speaks louder than words. And so often family members say, this is the last time I'm going to say this. This is the last time we're going to give you $100. This is the last time we're going to pay your car insurance. This is the last time we're going to bail you out. This is the last time we're going to, all of those things, So really make it the last time, which is part of letting go and stopping enabling. So action speaks louder than words.
So it's not too late ever.
No, it's never too late. And the other thing is that family members frequently need to get some support to get into recovery. And that's why there's Al-Anon and Gam-Anon and family therapy. Because family member, there's that cliche in recovery, whether it's the alcoholic drug addict or the family member. You alone can do it, but you don't have to do it alone. Support makes all the difference in the world. To be able to talk about how difficult this is, how scary this is, how much we love our son or our daughter, our mom or our dad. To hear other people say that they've been through the same thing, but they've been successful at this, and to have heart, to get support. So going to a 12-step support group like Al-Anon or Gam-Anon, going to a family therapist can make all the difference in the world. To get the support that someone needs to have the encouragement and the courage to stop enabling and to allow those natural consequences.
Have the courage to pull that mattress out
the courage
for
to
their
change.
issues.
Tough to do.
Yes, yes.
You know, when you talk about the idea of breaking that addiction, and they have the support, what about the, we were talking about the family member with the tough love issue. Also, what about the addict themselves that say they don't have a problem and they can't recognize a problem? How do we address that?
Yeah. Well, you know, there are a number of therapy tools that if someone is willing to engage in therapy, we can begin to guide them through that. There's a whole paradigm that talks about the stages of change where someone has no idea that they have a problem or they're beginning to think that maybe I do have a problem. And so one of the things that we will do, like I've written a number of textbooks and workbooks for people in addiction recovery. One of those things is called a First Step Workbook, where there are about 50 questions that someone walks through. When did you have your first drink or drug? When did you gamble first? When did you first get in trouble? What was the first trouble with your employer? And so it walks someone through this, and they journal about this.
Right.
And then they sit down with me as a therapist, and they walk through this. And then to some extent, they're willing to be honest. To some extent, they'll minimize or deny. But at the end of the time, I'll talk with them, and I'll say, are you beginning to see a pattern here? Are you beginning to see that maybe you do have a problem? Sometimes people say, no, I don't see a pattern here. If you had the wife I had, you'd drink too. That's what they will come back to, huh?
Exactly.
Then I will say, are you willing to come back again? Are you willing to come back, and let's talk about this a little bit more. And so it's just like a diamond cutter looks for that place where you hit a diamond and everything. That's what we do as a therapist. We look for that one place, and so we invite them to come back, and we keep searching for that one time when there's an opening, and then to go into that opening and say, okay, let's take a look at this. In that aha moment.
Hold that thought. We got to go to a break. We're going to be back with Tom Lavin. We're talking about addiction. Don't go anywhere.
Welcome back to Lawyers, Guns, and Money. I'm David Houston.
And I'm Scott Freeman. We're pleased to have as guest psychotherapist Tom Lavin, who's been on our show a number of times, and we're talking about addiction.
Tom, you'll have situations, at least in our practice, well, we'll run across that person who has been in trouble with the law, maybe once, maybe twice, and we'll try to talk to them, and their response is always, well, I'm old enough to do this, and I only go out and drink maybe once or twice a week, and all my friends do the same thing. And you're in that position then where you don't have a person drinking or doing drugs every day, but what you're trying to do is convince them that what they are doing is still damaging to their life and their lifestyle, as well as the people that care about them. It's damaging to their health. How do you get across to that person if they say, well, it's only a few times a week and all my friends do it?
Yeah, it's only a few times a week, and then only my friends do it, or all my friends do it. I will talk with them about this idea about birds of a feather flock together. It's like, well, do you think everyone behaves this way?
Right. And
then the next question is, how well is this working for you? If this behavior is working for you, go ahead and continue. But take a look at your life with, the compulsive eating, the gambling, the compulsive sex, the methamphetamine, the marijuana, the alcohol, the opiates for the chronic pain. How well is this working for you? And usually that hits them right in the face.
Right.
Let's take an honest look at this. So I will share with them, I'm not trying to make a point against you. Let's look at this. Is this working for you? And if it is, I will support you with this behavior. Mm-hmm. I will support you against your family if this behavior is working for you. Yeah. I will tell them to get off of your back. Mm-hmm. But if you're willing to be honest and take a look at physically, mentally, emotionally, spiritually, socially, career-wise, is this behavior working for you? And if you're willing to be honest, then let's take a look at that. And when someone's willing to do an inventory and see that it's really not working for them, then that opening begins, and that's when recovery can occur.
Right. I think universally, the reason I was sort of chuckling when you said if this behavior is working, by very definition, addictions to alcohol and drugs don't work. That's a very safe position to take from a psychotherapist standpoint. Right.
Yes,
but I don't think there's ever been a time when you've called the family and said, this drug addiction or this alcoholism is really working out really well. They're really working for you. I think you should have their back.
So I'm going to try.
Exactly. That would turn psychotherapy on its head, and I don't think it is. But the point being is that when they do take the inventory, they'll see things like making bad decisions, checkbooks go to zero. Right. Their relationships are all askew. They can't make the right decisions for their lives. And it's not, huge, monumental decisions. It's life, everyday decisions.
And you know what an important one too, Scott, is looking in the mirror.
Yeah. That's
one of the things that I will ask them to do, especially someone that's denying or minimizing, and I'll ask them, how well is this working for you? And they do that inventory. I'll say, look yourself in the mirror a couple of times before you come back next week. And just look yourself in the mirror. And not like, oh, I got to fix my hair or something, but look in your eyes. And then the other thing I will ask them is really look into your family members' eyes. Yeah. Not just like you're scamming something or but look into your wife or your husband's or your children or your grandchildren's eyes. What are you seeing back from them? And quite frequently then the person, that again can be that moment of honesty when they look into the eyes of their loved one who will not look them in the eyes, or their eyes begin to tear up because of what dad or mom or grandma or grandpa are doing to themselves. there again, that's that moment of truth that can break through for
Or
them.
children.
Well,
Yes,
too.
they're children. Yes, very much.
There's a lot of times when you're alone, it's very difficult to lie to yourself.
Yes.
Now, one of the things that I did want to bring up is the fact that the community also has a chance, at least in a general sense, to certainly benefit from a lot of your knowledge, because you also have a program on television where you're able to confront a lot of these problems in general. And can you give us a little idea about your show and how that works? Because obviously it's not for a specific individual, but certainly a lot of general rules and discussion. But give us an idea what goes on.
Yeah, thank you, David. On KOLO, Channel 8, on Sunday mornings at 6:30, the third and fourth Sunday of the month.
Right.
And then also on my website, there will be, it'll be the 17th year of the show on KOLO.
Really?
All of 2011, we are dedicated to dealing with addiction recovery. It's really great. We're going to have experts from all over northern Nevada, from UNR, the addictions medical director, Dr. Tim Coughlin, people from Step 2, from Bristlecone, from Northern Nevada Adult Mental Health Services, 16 experts on 14 shows throughout 2011 talking about women's issues, children's issues, cross-addiction, dual disorders, 12-step groups, chronic pain, opiate addiction, all of these different themes. And so if people want to tune in, I know Sunday morning at 6:30 is late or early. It's late for an addict,
Depends on
but
your
it's early
audience.
but it's
Depends
early
on
for
your
most
audience.
people. So if you're just rolling in, you can watch the show.
Exactly. There you go.
But it's early for a lot of people. So set up your DVRs, or
Right.
they can go to my website and watch the show. It'll be on for the next couple of years.
You know, I've been on the news lately and on television lately, and I'm sure they'd be very accepting for me to mention it. Mayor Cashel, his son also went through some addiction, and they were talking about how it can affect everybody. That's a great example of addiction affecting every type of walk of life, including our illustrious mayor and his son, and he's recovered real well, and he's a message in and of himself, and I know they're very, very outspoken about that. So when you talk about what do, you don't know what to do, and that's part of their message, is that when the mayor was faced with it with his son, he didn't know how to go up to him and say, stop using your methamphetamine. You know, he didn't know how to do it. So what are some of the lessons that you would say to a parent that's completely lost when their child is addicted to a drug, whether it be marijuana or methamphetamine, and you don't have the tools? What do they do to try to cope? Is that another pulling the mattress out situation?
Well, you know, again, honesty is one of the important things. Just like the alcoholic or drug addict, or again, compulsive gambler or overeater or sex addict comes up with denial and they minimize, they have a lot of times parents have excuses too. You know, it's just a phase that he or she is going through, or it was because of the divorce, or because their child has a learning disability. They're going through a hard time and they'll be okay. Or if we wouldn't have treated little Joey this way when he was 14, he wouldn't be doing this, so I feel guilty.
They blame themselves.
They blame themselves. And so again, this idea of going back to responsibility, that the fact that maybe you did make a mistake as a parent back when your child was 11 or 12 or 13, that's no reason for them to continue to drink or use drugs or act out with gambling or sexually. Let them take responsibility. The other thing is take responsibility for yourself. Your own depression, your own anxiety, your own guilt and shame. This again is where family members can really be helped, going to therapy, going to 12-step groups. Other people go to church groups, they go and talk with chaplains. This idea of you alone can do it, but you don't have to do it alone. So often, because we feel ashamed, either as recovering alcoholics or drug addicts or addicts in general, or the family feels ashamed too. The family tries to cover it up. We don't want everybody to know about what's happening with our son or our daughter or our wife. To bring it out into the open and to begin to talk about it. And if it's first of all just in a little closed 12-step group, or if it's in a counselor's office just talking with one therapist, to begin to be honest with oneself and bringing out into the open is really an important first step in recovery, to go past the shame.
Hold that thought. We've got to go to a break. We're going to be back for our last segment with psychotherapist Tom Lavin.
Don't go away. Welcome back to Lawyers, Guns, and Money. I'm David Houston.
I'm Scott Freeman. We're pleased to welcome our guest Tom Lavin, who's a psychotherapist, and we're talking about addiction.
Tom, there's a question I have for you concerning this. It seems like a modern-day media bonanza on rehabilitation. We've got Celebrity Rehab, you've got TMZ and the other associated media outlets, Radar Online, that seem to specialize in this notion of following rehabilitations, almost like you got to have a scorecard so you can see how they did on a given day, and if they didn't, how badly they did. Are we hurting the general concept of rehab and the severity of the problem by commercializing it to the extent we have in the media? In other words, taking celebrities and putting them on television so everybody can watch them throw up in a bucket. Or are we making it then better known so everyone can embrace it as possibly a solution for them? In other words, if my celebrity that I admire went through it, I could do it too. What do you think's the balance there?
Message.
Well, that's a great question.
Thank
And
you.
one of the things that I would like people to know is that with rehabilitation, when it's really rehabilitation, it really works and it really helps people change their lives. It saves lives.
Right.
I mean, if we take a look at just the rehabilitation programs here in Reno, whether it's Life Skills or West Hills or Bristlecone or Step 2, Northern Nevada Adult Mental Health Services, these are life rafts for people that are drowning. These save people's lives. Treatment really does work, or as well as just the different programs all around Northern Nevada, Vitality Center. All of these programs save people's lives, people that are dying as a result of their addiction.
Right.
On the other hand, with all this publicity, people can begin to think that it's really superfluous or that it's superficial or that you just go there to hide out. People go into rehabilitation to work, Dave. They really have to work on themselves physically, mentally, emotionally, spiritually, and socially. Group therapy, individual counseling, sometimes medication management, deep soul searching, a lot of really good hard work, soul surgery goes on in a treatment center. But again, people can have the wrong idea and they can think it's an excuse or you just go there to hide out.
Exactly.
And that's not what a real treatment center is, and I hope whatever celebrities go to celebrity treatment centers, that's not what they're doing. Now, of course, whether one's a psychiatrist, a psychologist, a psychotherapist, a marriage and family therapist, an addictions counselor, first of all, we have a commitment to the patient to do no harm. We have a commitment to the patient to do what's right. In other words, to not be self-centered, to not be self-serving. If we lose track of that, yes, people can get off track, and whether it's an individual patient here in Reno or it's some celebrity client in Southern California, they can be exploited or manipulated rather than helped. And so the ethics of healthcare is to do no harm and to do everything we can do to help our patient, not thinking about ourselves. We're not supposed to be thinking about ourselves. Who is this patient? What are their needs? Can I help them? And if I can't help them, we need to refer them to someone who can help them. And my experience in Northern Nevada is we have a great recovery community here that people can trust, that people will do a good assessment, they'll offer really good ethical therapy, and that people can trust that. Now, your question too, it brings me back to 35 years ago when I did my internship on Skid Row in Detroit. It was on Skid Row. It was a Skid Row treatment center. People from the suburbs started getting referred to our treatment center rather than the fancy treatment centers out in Bloomfield Hills or Grosse Pointe because it was starting to be too foo-foo and too fancy. And one of the things that's real important in recovery is humility and to learn to identify with other people. And so that's one of the things that was accomplished in not being in a big highfalutin treatment center.
Exactly.
Okay.
Well, Tom, as always, we've run out of time, and we love having you on the show because, we have people that we interview that are entertaining and so forth, but you're helpful and entertaining. We really appreciate that. And so don't forget to watch Lawyers, Guns, and Money on Tuesday night, cable channel 3 at 10:30 for a rerun of Tom's show, as well as our new time, which is our old time, at 4:30 on Sunday afternoons. We used to be before football. Now no football. We're on at 4:30. Be sure to tune in.
Tom, thank you for joining us. Tune in to Tom's show, and thank you very much for being with us.
See you next week.
Happy Sunday.